you have my cell phone?
I do not have your cell phone. You took your cell phone back. Okay. I don't have your cell phone. It's not in my pocket. I included it in my videos for that. And we'll do a big shout out to you. She's just not here for like 7. So she's teaching 7. She's like, we're not starting until 2. Yeah.
They pronouns, and I'm honored to be co-hosting this year's Women's March with State Rep Amanda Toll, my best friend over here, Superwoman, greatest lady in the world. I spoke at last year's event about my abortion experience, and I originally thought that I would do the same at this year, but I decided to write a bit of a love letter to you all instead. So, without further ado, here we go. Dear women, femmes, queens, and everybody in between. It's far too easy in this twisted world to forget the value of our worth. We are life bringers and warriors, conquerors and queens. No one on this earth would exist without our beings. We are portals to other dimensions and worlds unseen. We are more capable than our society has led us to believe. We are turning the tides to freedom and peace, to a world where women are equally free to be absolutely anything we want to be. Thank you. Mothers and daughters, sisters and friends, we are all bound by the exact same thread. No matter your color, no matter your creed, no matter your body, no matter your means. You are a woman, which means you are a powerful being. So however you came to the tribe we call she, please remember that you are welcomed and loved and forever truly seen. Thank you. And I would love to introduce our wonderful, feminist, amazing queen of a woman, State Rep Amanda Toll. Thank you very much.
Good morning, everyone. Well, now actually I'm just so grateful to be here today. I'm so grateful to be your state rep, and just thank you so much for being here to speak up against the attacks on our reproductive freedom. As you may know, I have not been shy about speaking about my own abortion, which I had when I was a teenager. My abortion let me live the life I want to live, to go to college and grad school, to open my own business, to have a child when I was ready, and to become a state representative. I am not shy in speaking out about my abortion, in part because abortion is a routine medical procedure. 1 in 4 people able to get pregnant have an abortion. 18% of pregnancies end in induced abortions. We've heard the narrative that Governor Sununu's abortion ban is extreme because it doesn't allow exemptions for rape and incest. And while yes, it is difficult to think about a rape survivor being prevented from accessing an abortion, I'm here to remind us that any limits placed on abortion are extreme, because abortions are routine medical procedures that allow people to make their own choices about their lives and their bodies. Parental notification laws are extreme. Ultrasound requirements are extreme. Mandatory waiting periods are extreme. The Hyde Amendment, which prevents federal funding from being used for abortions, is extreme. Any limit on abortions is extreme because abortion is health care. We need to be advocating for abortion rights and normalizing full-spectrum reproductive health care. But we also need to remember, folks aren't making reproductive decisions in a vacuum. As feminist scholar Ricky Solinger says, there are beggars and there are choosers. If someone carries a pregnancy to term because they cannot afford an abortion because their Medicaid doesn't cover it, is that really a choice? If someone terminates a wanted pregnancy because they cannot take parental leave for their job, is that really a choice? To be truly pro-choice, you need to create conditions that allow people to thrive. To bring about reproductive justice, we need a living wage for all. Access to affordable child care for all. Good schools for all and Medicare for all. Only then will people terminate a pregnancy if they don't want to carry it through, or to have a child and raise it in safe, healthy, and an economically secure environment. As a result, if you identify as pro-choice or a feminist and don't already, I'm calling you in to support the following initiatives. The Raise the Wage Act, and don't leave tipped workers more likely to be people who identify as women behind. Yep. Universal health care. You cannot have good access to reproductive health care if you don't have access to health care in general. Paid family leave. Policies friendly to labor unions, which are proven to better wages and working conditions for workers. And universal child care. Another way to support reproductive justice is to support our health centers who provide crucial reproductive health services. Joan Loving Center, Equality Health Center, and Planned Parenthood. And since we currently don't live in a state which abortions can be paid for with state or federal money, it is imperative that we support the Reproductive Freedom Fund of New Hampshire, the state's only abortion fund, and make this procedure accessible. Assure that our feminism is not just serving a small number of privileged people. We need to go to bat for intersectional reproductive justice, which includes advocating for LGBTQ+ justice, racial justice, and policies emphasizing economic justice, just as we are going to bat for abortion rights. Abortion is good, but a progressive intersectional platform that includes full spectrum health care, which covers abortion, is great. Roe is sacred, but let's be clear as daylight that Roe is the floor. We must build from this foundation towards reproductive justice that advocates for all. Thank you so much. Our next speaker here to represent the Reproductive Freedom Fund of New Hampshire and New Hampshire Youth Movement activist, Nat Wood.
Hi there. Let me just get this up. Perfect. Hi everyone. Thank you all for joining us on this lovely fall day. My name is Nat Wood, and my pronouns are they, them. And I am a non-binary person whose reproductive rights have been threatened by the recent legislation passed by our Governor Sununu. Reproductive rights encompass all genders. At this Women's March, I want us to uplift women's voices as well as all of the voices of trans individuals who are impacted by these attacks on our bodily autonomy. As Representative Amanda Toll just said, abortions are routine healthcare procedures. Access to safe and affordable abortions is necessary as it is healthcare. I'm going to pause. Because the state does not fund abortions, it leaves people with an expensive weight on their shoulders if they are in need of an abortion. Luckily, there's an organization set in place to help provide funding for safe abortions. The Reproductive Freedom Fund of New Hampshire was launched February of this year and has already helped provide funding for 135 abortions, totaling over $40,000 a pair. To donate, look up ReproFund NH, ReProfundNH on Instagram or Google. The link to donating is in their bio on Instagram and on their website. Restricting access to abortions is attacking people's bodily autonomy. As a trans person, my bodily autonomy is being attacked from all angles. My reproductive rights are in danger, as well as my right to have access to gender-affirming care. To be a feminist and support reproductive rights means to support everyone's bodily autonomy. Thank you.
Our next speaker is Jim Murphy, who helped play a critical role in getting the city of Keene to pass a Medicare for All resolution, and has been a long-time activist in rights and democracy. So happy to have you here today. Thank you, Jim.
Okay, I'm not really reading off of this, but everybody I see giving a speech nowadays is holding up a cell phone. So Amanda said I'm on the leadership team of Rights and Democracy, and I started out in 2016 with Rights and Democracy of Monadnock. I've always been interested in healthcare and the need for universal healthcare in this country, and I have done what I can to promote Medicare for all. I'm a Keene resident of 47 years, and for most of that time, I worked as an oncology nurse, chemotherapy, biotherapy, hospice, and palliative care. And on a daily basis, I would see, all the financial problems that became a burden to everybody going through their treatment. It could be just like rides to Lebanon or something, that they have to make frequently, or staying at hotels. It was, so, anyway, even with good health insurance, there's a burden there. So I was witnessed the need for a more holistic approach, in which is Medicare for all. And I'm currently receiving Medicare myself, being of that age, and as with all over 65, it covers about 80% of medical care. It doesn't cover everything. It certainly doesn't cover the medication, so there could still be a considerable cost. But what I am covered for, it works really well, because you don't have to go through all these insurance companies, except for the extra stuff like medication. But the government does a great job running it. The costs over the years, especially from the 1970s, have just escalated, and that's not because of the doctors making so much more money or the nurses relative to the economy, but to the fact that insurance companies just keep making more and more and more money, and making it much more complicated, with certainly physicians spending a lot of time dealing with insurance companies. And the right has perpetuated myths about, if we ever get Medicare for all, we won't be able to choose our own doctors, go to a hospital we want to, and we have to wait in lines. Well, none of that is true. It's all made up. Just going back a little bit, in Europe, it was started actually the first time under Bismarck. That was 1889, so it goes back a ways, and they have excellent healthcare system. They spend less than we do and get better outcomes. In this country, 1945, President Truman had become the first president to propose national health insurance, an initiative that was opposed at the time by Congress. It wasn't until July 30th, 1965, that President Lyndon B. Johnson signed in Medicare, a health insurance program for the elderly Americans. The law, the Medicare program provided hospital and medical insurance for Americans age 65 or older. Of course, most people died at 65. And then that was signed into law as an amendment to Social Security Act of 35. So today, present time, Pamela Jayapal and Debbie Dingell introduced Medicare for All Act 2021. It was a transformative legislation that would guarantee health care to everyone in America as a human right at a moment in which nearly 100 million people are uninsured or underinsured during the pandemic. The Medicare for All Act of 2021 was introduced a year to the day of when COVID virus was first confirmed in all 50 states and the District of Columbia. This was a devastating public health crisis which has taken the lives of more than 700,000 people. And that's all. I mean, it's incredible. It's mind-boggling. If you compare it to anything, all the wars we had, this is more people. And it has underscored how the country's current healthcare system that leaves millions behind. Congresswoman Jayapal said, while this devastating pandemic is shining a bright light on our broken for-profit healthcare system, we were already leaving nearly half of all the adults under the age of 65 uninsured or underinsured before the COVID hit. And we were cruelly doing so while paying more per capita for health care than any other country in the world. Bonnie Castillo, RN and Executive Director of National Nurses United, said, Medicare for All will ensure everyone has health care coverage, including when they most need it. And it will eliminate the waste and profiteering that drives the cost the pandemic has The pandemic has highlighted in deadly detail that nurses have known for decades. Our current healthcare system, based on private insurance, tied to employment, is a colossal failure and leaves far too many of our patients to suffer and die unnecessarily. So the negotiations go on. It's hard to know where this is all going, but for the reconciliation bill, and will hopefully favor a big step forward towards Medicare for all. It won't flip the switch or anything, but and it's what our country wants and needs at this time.
So our next speaker is from End Sexual Violence on Campus. I'm so excited about these young activists. This organization came on my radar because they approached me, one of their founders, Reagan, to put in legislation to mandate that our schools incorporate consent as part of their health curriculum. Unfortunately, in New Hampshire, consent currently is not part of the curriculum, and it just shows that really young activists can make a difference because I have now put in that legislation. And even if it doesn't pass because we have this horrific right-wing legislature, we're going to keep fighting the good fight. And we cannot just be trying to hold up the bad stuff. We have to go to bat for what we want. And so without further ado, let's please welcome Hazel from End Sexual Violence on Campus.
Hello everybody. My name is Hazel Armstrong McAvoy. I use she, her pronouns, and I'm a junior at Combat Regional High School. I am a member of End Sexual Violence on Campus, also known as SVOC. SVOC is a youth and student-led organization based in the Monadnock region. Our goals are to uplift and empower survivors by starting much-needed conversations about sex and consent, provide safe places for survivors to share their stories, and make menstrual and sexual health care products more attainable. Over the past year of being a part of SBOC, this organization has truly helped me learn about what rights I have and I'm entitled to. This includes my access to contraception and other products to keep myself and others protected. A couple of years ago, my significant other and I needed a condom. Although that sounds like something that is easily accessible, it was impossible for us. Oops, sorry. The town health center that provided condoms and other products to teenagers for a low cost had been closed all week. We couldn't get them from a grocery store because one of our mutual friends had a parent who worked there. If we were ever confronted about that, we would have to share a side of our relationship we'd prefer to keep private with an unknown adult. And the last thing we wanted to do was ask our parents to provide us with one because of the questions that would follow. The school I attended also had an abstinence-based sex education, meaning that sex was something to never do. It preached that abstaining from sex is the only way to avoid pregnancy, STIs, STDs, and STDs, which I found out later through being a part of SBOC is completely untrue. Medication, vaccines, and abortion clinics are all here for a reason. With the abstinence education that was forced on me still being in my mind, although my significant other and I knew what we wanted to do, I couldn't help but feel like I was wrong for wanting a condom. The stigma around all, oh my gosh, the stigma and all around lack of access to sexual health care was surrounding us, and it continues today for young people throughout this country. While this may seem like a simple question of accessibility, the nature of this issue is far more indicative of the sex-negative and misogynistic culture. These products have been so stigmatized that the safety from STDs, preventing pregnancy, and pleasure are now policed by one's ability to pay for a $20 box of condoms and $50 plus for Plan B or any kind of contraception. The fact that these products are predominantly purchased by young people, specifically young women, cannot be ignored. You cannot separate the fact that these products are not accessible and are pricey for a reason. There was a collective consensus that the health of young women and sexual safety of young people around the world was an unimportant investment. To help combat these issues and allow healthcare to be put in the hands of the people, we created the program Sexual Healthcare Anonymous Distribution Effort, also known as SHADE. Through this service, we are able to provide free menstrual and sexual healthcare products for anyone that needs them, with no questions asked. Whether that be condoms, Plan B, tampons, sanitary wipes, lube, or anything that you request, we will provide it safely and anonymously to you. With the recent legislation, budget passes and executive council choices made in New Hampshire regarding the erasure of sex and consent in HB 544, a significant decrease of funding towards reproductive centers, and schools not providing students with access to menstrual health care products in the bill, HB 458, services like SHADE are in direct attack. Our organization is in direct attack. The work we've done throughout this service is extremely crucial to keeping young people safe and aware of the resources we have. Why are we still having to fight laws based around what we can and can't do with our own bodies? Why is New Hampshire Congress coming for me as a young person for simply wanting health care? It's truly not fair, and we need your assistance. SHADE is completely funded through donations, whether that be money or products. In order to keep this effort in motion, we would appreciate it if you donate to our organization, help us spread the word about the work we do, or support us in any way you are able. It's up to you and countless others. If you want to learn more or have any questions about end sexual violence on campus, you can stop by our table, which is over there, and talk to me or any of our other lovely members. You can follow us on our social media accounts at SVOCNH, ESVOCNH, or you can visit our website, svoc.org. Do your part to keep us safe. Thank you.
We recently had elections for the Keene Democrats, and we elected added 19 progressive activists to that committee, and I am so excited to have people who are activists first, politicians second on that committee. And our chair now, Sean, is going to speak. Thank you.
My friends, have you had enough yet? Have you had enough of a party that doesn't believe in science and won't take the basic measures necessary to end this pandemic? Have you had enough of a party that doesn't support public education and will decimate our public schools and will leave our public colleges and universities to languish? Have you had enough of a party that doesn't support LGBTQIA rights and will leave our LGBTQIA friends out to the wayside? And have you had enough of a party that doesn't support our Constitution and our right to sexual privacy and a woman's right to choose? Because I'll tell you, I've had enough. And this is just Act 1 of a sociopathic party that has misread gerrymandering for mandate. And if you've had enough, then every single day between now and next November, turn their voicemail into a torrent of rage. Every single day between now and next November, turn their email into a never-ending litany of our discontent. Every single day between now and next November, turn their mailbox into a flood of our anger. And most importantly, every single day between now and next November, tell every single one of your friends, every one of your neighbors, every one of your acquaintances, get out to vote so that next November, every Republican state legislator, every Republican state senator, every Republican executive counselor, and Governor Sununu are unemployed so that they know when you mess with a woman's right to choose, there is hell to pay. So one more time, my friends, have you had enough yet? Then join me, join Amanda, and join the Keene Democrats and take our state back. We've had enough.
Also recently elected to the Keene Democrats team. She's Keene's, to my knowledge, only full-spectrum Duma, and she's a fellow abortion storyteller. Please welcome Renee Montiel.
Hey friends, comrades, members of the community. Got my paper. No phone for me. I stand here in front of you today at a time we are struggling to keep our bodily autonomy. With both abortion and contraception access under attack, we must act now. Those who represent us in our current government are limiting our rights to make decisions about our reproductive choices. They continue to pass legislation that is a perpetuation of misogynistic values and tradition. If our representatives are not centering families, women, and communities, who are they centering? Rather than just looking at abortion as a personal and private decision, we need to, what? Louder? Louder! Rather than just looking at abortion as a personal and private decision. We need to expose the power structure that is using these restrictions on abortion into funding access to contraception to extract our unpaid labor. It's important for us to understand why the power structure wants to limit our reproductive rights. The truth is that abortion laws are about economics. When our society experiences a low birth rate, our reproductive freedoms are taken away from us. And that is what we are facing right now. We are still considered property. We are expected to do free domestic labor. So the ruling class has a workforce to perform cheap labor. While people are struggling to house and feed themselves and their families, struggling to afford child care and basic health care, our government officials have the audacity to attack our reproductive freedoms. We must demand more from those in office that are meant to represent us. We must make them uncomfortable. We must do more when people are denied access to reproductive health care. We must take aim at all institutions of social and sexual oppression. Forcing people to carry an unwanted pregnancy and give birth is nothing less than assault, and not allowing us complete sovereignty over our reproductive system is sexual terrorism. Let me end on this. True reproductive justice involves not only access to abortion, contraception, and health care, but it provides those things as well to people in immigration detention centers, to people that are imprisoned, and those who have been deemed unworthy to make decisions about their own bodies. It is imperative that we have personal freedom in all things related to our bodies. And one last thing, this goes out to Matt Gassis and the Executive Council. We are coming for your seats. We, the queer, the trans, the people of color, the feminists, the single moms that are fucking pissed. We are coming for your seats.
Okay, our next speaker is the newly elected chair of the Cheshire Democrats. We had such an effort to elect him, and he is showing up for us over and over and over again, fighting the good fight. Let's welcome Mohammed.
Thank you, Amanda, and thank you for everyone who has showed up. It's so heartening to see that we strongly believe in women's rights. To me, women's right is human right, and it's at the top of the human right. It comes first. I wish my daughter was here. She's sick with a strep throat today. She's a senior, and it's the most important issue for her. But you don't have to have a daughter to realize that right to reproductive health care is fundamental to your personal growth and flourishing and developing to your full potential. I have seen that. Those of you who do not know, I come from Bangladesh, and I have seen in my lifetime 3 generations where my grandmother barely had any access to education, and my mother, she was the smartest person I knew, was burdened with the life that she may not have chosen herself. And then I saw my sisters, and they were able to go to universities and have education and have life that or they were able to live full potential. So that is happening without our realization. When you take away the freedom, reproductive freedom, you take away the potential for people flourishing and achieving their potential. One other comment I want to make that Sean made is that the fight for reproductive right is fight for truth and fight for science. Because many of the arguments that are made to prevent a reproductive right is not based on solid science. And we have to, at every point in our life, enforce policies and elect leaders that believe in science. And finally, I want to make a point that as men, the impact of these policies are not felt firsthand. I can guarantee if a 16-year-old boy's life was altered, just as much as a 16-year-old girl's life is altered when she doesn't have access to reproductive rights, our policymakers would start thinking differently. And lastly, I believe in women's right to choose. This is a deeply personal issue, but I believe we need to go even further and say we stand by their choice. We stand by their choice, and it's an ethical choice that the woman is making. It is not sufficient just to say that it's a woman's right to choose. That leaves this open for discussion. I don't think it's open for discussion. It is a fundamental and ethical right for every woman to choose reproductive decisions. Okay, so finally, elections matter. So with Sean, I will say everyone who is taking these rights away from us, please vote them out. Show up to canvas. Go to Keene webpage, Cheshire webpage. There are canvassing opportunities coming for the coming election. Please join us. Thank you.
Oftentimes with elections, so frequently we only think about the presidential election and those people who are our federal delegation, and that is of critical importance. Like, I don't want to in any way, shape, or form undermine that. That's important. But our local elections really, really matter too. And our city council needs to go in a more progressive direction. And with that, we have some of those progressive city councilors here today, and we want to give them more support by electing my fellow progressive mom, Jody Newell, to the Keene City Council. Let's introduce her.
Hello, all. Wow, it's actually at my height. That's amazing. My name's Jody Newell, and if you talk to me for basically any amount of time, you'll know that I'm a mom. I harp on my kids. It's understandable, right? It is what it is, because my life is basically revolves around my children for the last 13 years. That's what being a mom is, right? Interesting to note, though, what I didn't realize was that being a mom opens you up to a level of scrutiny and judgment that I was not aware of before. I often tell the story of how I moved to Keene, and essential to that story is the lack of side-eye that I got from other people around me, from my kids and I. Because I'm walking around with two really rambunctious little boys, doing what rambunctious little boys do. And but for some reason, everybody wanted to make up their mind about what I should do, right? Over the years, even well-intentioned individuals sometimes couldn't understand why I made the choices I did, and that's understandable because they're not me, and they're not in my situation. Yet, here we are, seeing what I would argue is the single most life-altering decision being taken away from us, our own judgment being overridden and undermined by people who intentionally distance themselves from the problem, imposing understandably inappropriate and downright reckless attempt at solutions. Last week, we saw one of the last European states remove their ban on abortion,
77% of the voting public came out to support a woman's reproductive rights to choose. If we were to do the same thing here, the numbers would be fairly similar, because across the nation, the vast majority of people support a woman's right to choose. Yet somehow, a handful of powerful characters can upend decades of progress to make judgments about and decisions for the rest of us. We know, though, that all too often, even staunch anti-choice advocates don't believe in this policy for themselves, right? They don't believe in this policy for themselves because, after all, if you're in that situation, it's a lot easier for you to understand that the circumstances of your situation merit an exception to this rule. And at the end of the day, what it seems to me is that it's pretty simple. Are we going to support women? Are we going to trust women to make their own decisions? Are we going to believe women? Or are we going to judge, restrict, and condemn them? I think you know where I stand, and I appreciate all y'all for being here.
I see some of our city councilors that are standing in solidarity with us today. Councilor Madison, Bobby Williams, Kat Workman, we're so grateful for you guys being here. Thank you. And so our next speaker is our city councilor, Catherine Kat Workman. She was endorsed by SCIU. She helped push forward the Medicare for All initiative, and so we're happy to have her join us today. Thank you. Thank you, Amanda, for the invite. It's my pleasure to be here. And I, like Renee, also have a paper. I chose to speak today because I could not be silent given the recent assault on reproductive rights and freedom on the state and national levels. Women's reproductive rights are far more reaching than just abortion. It really comes down to a woman being able to make medical decisions regarding her body with a trusted medical professional. It really shouldn't be anyone else's business. However, there's this long-standing history of males in power trying to legislate and limit rights to reproductive freedoms as if we can't think for ourselves or don't deserve autonomy over our bodies. As part of the state budget passed over the summer, which I would argue should not have even been included in the budget, New Hampshire has added further restrictions on women's reproductive freedoms and right to choose. Unless repealed, effective January 1st, 2022, there will be a 24-week abortion ban, making it illegal to have an abortion past that time, even in cases of rape and incest. Furthermore, while the law is written to suggest that the purpose of an ultrasound is to determine the gestational age of the fetus, let's be real, it's a shame tactic and intended to make a woman second-guess her decision. Even the wording, gestational age of fetus, is meant to convey emotion. There is far less intrusive ways to determine the phase of pregnancy without having to endure costly and invasive medical procedure. Luckily, much of the medical community has already spoken out against these new laws, citing no health or safety benefits to them. The Executive Council's recent decision to reject extending contracts to several family planning agencies, such as Planned Parenthood of New England, is essentially defunding these agencies and will not only negatively impact the agencies, but also the communities they serve. The office in Keene, just a block down,
provides access to reproductive and physical health care to some of our most vulnerable populations. Specific services provided to our community include access to birth control, women and men's health care, LGBTQIA services, emergency contraceptive, HIV services, pregnancy testing services, primary care, sexual education, and STI testing, treatment, and vaccinations. From a public health standpoint, many of these services are critical to the vitality and safety of our community. By now, we have all heard of the Texas abortion bill that was signed into law, which currently is the harshest and most extreme reproductive rights restriction in the country. As we saw several weeks ago, the Texas law stands to dismantle Roe versus Wade. A closer look at the law was eye-opening. While I knew it prohibits abortion past 6 weeks, criminalizes medical providers who provide one past that time frame, and offers a financial incentive of $10,000 for others to report so-called accomplices, I was surprised to learn that the reporter is not only limited to a Texas resident, but any person in the country can sue a person who helps someone to get an abortion past 6 weeks. Additionally, a so-called accomplice isn't just limited to medical providers, but includes partners, friends, family members, or funding volunteers. Lastly, that $10,000 so-called reward for every successful lawsuit is actually just a minimum amount. I have a message for Governor Sununu. You can't claim to have always supported a woman's right to choose and never opposed late-term abortions, then turn around and enact laws that do just that. We see through you. Thankfully, there are currently a lot of momentum to have these laws repealed before January, but it will take all of us to speak out against this assault on women's reproductive freedom and bodily autonomy for all. Thank you. Sometimes, I think like white men, they get a bad rep, but there are some really good white men who really get it. I know I voted for Bernie Sanders in the Democratic primary because I felt like he was the most feminist candidate on the ballot because things like healthcare and raising the wage matter to everyone, and that includes women. And so one of my favorite white men on the planet is Representative Larry Welkowitz, who is always down to get into good trouble in Concord with me. And so, I see Joe Shapiro is here today. Without further ado, Larry, take it away.
Woo! Wow, it is great to see such a big crowd out here. I haven't seen a crowd like this in a long time in Keene, New Hampshire. I feel like something's happening. This is a moment, right? I'm a father. I have a daughter. Her name is Annika. She went to school right over here in the Keene Middle School. She's the reason I'm here. When Representative Amanda Toll asked me to speak, I said no. I said no 3 times. I I said, let's have some strong women up here, you know, and she did that, but she kept asking me, so here I am. My friend Mohammed, who spoke earlier, yay Mohammed, he's the real deal. Mohammed Salah and I had this ongoing conversation about the spaceship thing. So Mohammed says, Larry, imagine, Larry, that you and Annika are in a spaceship and you have a choice. You can either fly into the sun and save the world, or you can not fly into the sun and the world goes kaput. And I always tell Mohammed, I'm not going to fly into the sun, I'm saving my kid. The hell with the world. And Mohammed gets upset with me. We go back and forth on this. It's all about my kid, right? Does anybody here have a daughter? Anybody have a daughter? Do you want your daughter to live in a world where other people are telling her what she can do with her body? Do you want your daughter to go to schools here in New Hampshire where she is not allowed, nor are her teachers allowed, to talk about sexism and racism? Do you want your daughter to earn 3/4 of what a man earns for the same job? Let's see, no, right. I sat on the floor of the State House, just a few seats away from Representative Toll, when the Speaker of the House, Speaker Packard, I will name him, called a state woman representative a bitch. He said that, he thought he was off mic, we all heard it, and what I ask you is, do you want to live in a state where state leaders can degrade and humiliate women? Of course not. This town has some amazing women. Amanda Toll is one of them. And there are others. I see Sue Hay here. Sue has been a leader organizing women's rights events, protecting immigrants. Dottie Morris is here. Dottie, who works 7 days a week to improve what she calls a beloved community. She'll speak soon. Maybe next? Soon. We want to end on a bang. We'll end with Dottie. Please stay for Dottie Morris. Melinda Treadwell, the president of Keene State College, who grew up in New Hampshire, went to Keene State College, got a doctoral degree at Dartmouth, and is working 7 days a week to keep that college afloat. Marianne Christensen, who started the Hannah Grimes Marketplace and the Hannah Grimes Center. It's a $2 million center just a couple blocks from here that helps, among other people, women entrepreneurs get moving. This town has some amazing women leaders, all great leaders, but all great leaders need followers too. Mohammed heard me talk about this. It's okay to be a follower. All leaders need followers. So I'm asking you, I'm pleading with you. You don't have to stand up here and just give speeches, but you do need to organize. You need to organize. You need to go to meetings. You need to go to meetings. You need to support that group that is trying. You need to knock on those doors. You need to talk to your friends. You need to ask them to join you. I'm going to keep doing this for my daughter. The time is now. The time on our watch is now. Thank you.
Our next speaker is a community organizer with Rights and Democracy. Rights and Democracy helps progressives across the state of New Hampshire get elected, including myself, and now they have endorsed Jody Newell. So we're really happy to have Heather Stockwell from Rights and Democracy with us today.
people on the sides so you can see the speakers a little bit better. I also like to move around a little bit, so I might just take this microphone off and walk around. You never know. Thanks for that introduction, Amanda, and thanks for being here today, all of you. Awesome job. Awesome job. So I'm Heather Stockwell. I'm a statewide campaign organizer. Thank you. Thank you very much. I'm a statewide campaign organizer for Rights and Democracy, New Hampshire, on healthcare and overdose crisis campaigns. I was part of the team that helped get the resolution passed here with Jim Murphy and Amanda Toll, some great activists in Keene, and some great doctors from PNHP, Physicians for a National Health Program. So if you want to talk about that after this and how you might get involved with one of those teams, we would love to have you. I lived in New Hampshire in the Monadnock region for over 50 years, from the age of 2. And now I raised my own family here in the Monadnock region. And 5 years ago, I found myself engulfed in political organizing work, trying to make this state better for folks. This past year has been harder than any other year before, partly because of COVID, or where I'm at in my life's journey, or the high rates of our New Hampshire health insurance premiums. But I know it's getting harder for people to live here. If it's harder for me, it's harder for many of the people I know. It's harder for working people and their families than ever before. And I want to just take a minute and quote, I don't know if any of you have watched some of the national federal testimony in our state capitol on this issue happening just in the last few days to a week. I'm going to quote Representative Pramila Jayapal, who I think was also talked about earlier. She's been a champion on getting health care for all of us, universal health care. In her testimony, she said, I am one of the 1 in 4 people or women who have gotten an abortion. And I come before you today as one of those 1 in 4 people. And I want us to take a moment, and I want everyone to take a look around at all of the women in this audience today and know that at least 1 in 4 of them has had to have an abortion for one reason or another. So take a minute and look around and look into the eyes of these women. We need you to believe us, and we need you to trust us to make the right decisions for us. It wasn't an easy decision for me, nor was it for any woman. But I knew that the man I'd been intimate with was not going to be there for me. He was not going to raise a child for me. I would be raising this child as a single mom on my own. I was still in college at the time. I had hopes and dreams for a life, a career. And I knew if I made that decision not to have an abortion, that those dreams would get swept under the rug for me and for many other women. I actually made that decision twice in my life. And then 21 years ago, I made the decision to have a child, deliberately. I was in the most stable relationship of my life. And I knew I was going to have some backup in this plan. And today, he's a marvelous 20-year-old man. And he's got me for a mom, telling him to treat women the right way. Sometimes I wonder what it would be like if I had 3 children right now instead of just 1. It would sure be different. I know that my life would have turned out very differently had I made those choices, but the choice was mine to make, not someone else's. So when Governor Sununu signed this budget, I was outraged. For the first time in over 50 years in New Hampshire, I have begun to feel like I don't belong here and I'm not wanted here. There are racial justice issues and school budget issues in this budget that should not be there. But the one that really stings the most is our right to have an abortion. And now the governor and the executive council have defunded all of the clinics that offer those services in our state. So, friends, make a donation to some of those great organizations if you're able. But I really want to take a few minutes with you today to take action. Because as you know, I'm an organizer. I'm all about taking action and taking it collectively because we are more powerful when we're all together. So today, I brought a simple action. If you have never, somebody was talking about emailing the governor, right? And I don't know how many of you have done that today, before. I know that might be out of some people's comfort zones. But we have a really great tool here. It's also, it's on my clipboard here. I'll come around and talk to folks after this, after I get done here. It's also over on Jody Newell's table. So there's a QR code. Simply take your camera out, click, you click a little box that pops up that says, do you want to go to this website? And if you say yes, then you put your information in, and then it brings you to the next page where there's an email directly that's going to go directly to Governor Sununu. I encourage everyone to, thank you, add your own, edit that email. You may edit that email, but there's something started for you. Give your own personal story, especially because with these things, if they see a lot of repetitive emails, they're going to know it's an app. And really, we need them to hear our stories. This is what makes all the difference. So please join me today and get involved with Rights and Democracy. We women need you. We need you all. We need you all to step up. Men, women, no matter how you identify, we need everyone to take action on this. Otherwise, this is going to continue. So, peace out. Thanks, y'all, for coming.
I'm so inspired by Heather, Sparrow, and Renee being brave and courageous and sharing their abortion stories with us today. They shouldn't have to do that, but they're doing it to help destigmatize this issue, to put a human face to this issue, and to help us push reproductive justice forward. So I just want to give a round of applause for these brave abortion storytellers. Sophia from the Keene Human Rights Committee, are you here? Yes! Awesome! Let's give it up for Sophia from the Keene Human Rights Committee.
Good afternoon. Okay. In any facet of American life that you can find statistics for, the numbers will tell you that while we've made progress in some areas, women continue to be at a disadvantage. There are thousands, no, millions of such statistics to choose from, and we don't have all day. We've got things to do. So I'm going to share a few with you that jump out at me. So, in the economy, women experience poverty at a higher rate than men. 1 in 4 unmarried mothers live in poverty, higher than unmarried women without children, higher than married women. Women with disabilities have a poverty rate of 22.9% compared to 17.9% for men with disabilities and 11% for women without disabilities. It's a comparable rate for African American women at 22.5, and it rises to 24.6 for Indigenous women. The statistics for LGBTQIA women are no better. With a reported 30% of bisexual women and 23% of lesbian women as of 2019, And unfortunately, I had trouble finding statistics for our transgendered siblings. The uncontrolled gender pay gap is closing, but we still only make 82 cents to a man's dollar. It is Indigenous women who are bringing down the average most at the moment, making 69 cents to a man's dollar. Women constitute only 8% of CEOs of Fortune 500 companies. Women of color only 1.2. Only one is an LGBTQ plus woman, and I wasn't able to find any info on Indigenous CEOs. When it comes to government, women constitute 28% of the 117th Congress and 35% of the New Hampshire legislature. As a reminder, though I hope this is obvious, we are 50% of the population. In the justice system, based on correlating multiple data sources, that sounded a little nerdy, I apologize. RAIN, the Rape, Abuse, Incest National Network, estimates that for every 1,000 rapes, 384 are reported. 57 result in arrest, 11 are referred for prosecution, 7 result in a felony conviction, and 6 result in incarceration. So for every 1,000 rapes that happen in this country, only 6 end up in incarceration. Again, according to RAIN, 90% of adult victims of rape are women. I want to take a moment to recognize the other 10%. All rape victims deserve justice. According to the statistics compiled by the ACLU, women who kill their partners will spend 15 years behind bars on average, while men who kill their female partners serve much shorter sentences, on the average between 2 to 6 years. The statistic alone is upsetting. But when you look into the motivations behind these killings, it brings it to a whole new level. Between 1980 and 2016, the number of women in prison or jail jumped 716%, almost twice the rate of men at 416%. 2/3 of those women are women of color. According to the American Journal of Managed Care, as of the end of 2020, the United States has the highest maternal mortality rate among 11 developed countries, 17.2 deaths per 100,000 births. In the Netherlands, that's 3. We have too few maternity care providers. We are the only of the 11 countries not to guarantee access to provider home visits and paid parental leave in the postpartum period. Yet we spend the highest percentage of our gross domestic product on health care. With these statistics, as with all of these statistics, the numbers get worse for women of color. The system shows us in obvious and subtle ways what it thinks of women. Off the top of my head, the obvious one that's been in the news and been discussed here all morning is that lawmakers are still trying to tell us what we can and cannot do with our bodies. One of the reasons given to justify the gender wage gap is that women leave the job market to have families. Really? Only women have families? More subtle, we have the social security system, the system designed to keep our senior citizens out of poverty, that gives the low-earning or home-keeping spouse, statistically and historically a woman, half the amount of her higher-earning partner. So, just another example of the unpaid work that women do that holds this society together being undervalued. Working on the home front is worth half of what my husband would deserve in retirement. Have you seen the cost of child care lately? And how about the fact that our founding documents read everywhere that all men are created equal? We've been trying to pass an amendment that states that women are equal to men since Alice Paul proposed the ERA in 1923. 98 years. Just to try and get the Constitution to state clearly that we have the same rights as any other citizens. So what do? I have some ideas. First, quite simply, we stand up for each other. We see these situations in our workplaces and in our homes while we're out living our lives. We support each other. when we're in a position of authority, we make sure injustice isn't happening on our watch. And we also demand that the men in our lives participate in this fight next to us, because the fight for equality is everyone's fight. Next, and it's been said a few times today, get involved in local elections. I'm guilty of not participating in school board elections myself. I told myself it was okay because I don't have any children. I don't plan to have children. It's not okay. It matters what the children in my community are being taught. I must participate in making sure that they are taught with equity. Municipal and state legislature elections are vitally important too, as we've heard today. Find out where your candidates stand. These elections decide what our children learn and who draws our voting districts. Lastly, we as women and our allies must be fighting for equity for people of color, indigenous people, the LGBTQIA and non-binary communities, immigrants, those living under the poverty line, the disabled, the mentally ill, the incarcerated, anyone whose rights are imperiled for so many reasons. Because failing to do so will leave some of us behind. Because the only way to ensure long-term that anyone has equity is to ensure that everyone has equity. Because the words of Martin Luther King, injustice anywhere is a threat to justice everywhere.
So, our next speaker, Natalie, serves in so many roles and has been a community activist in so many ways, standing up for LGBTQ+ rights, standing up for immigrant rights, going to bat for our schools. And so we're just so grateful, Natalie, to have you here today. Natalie also serves in the Cheshire Democrats.
Can everybody hear me? Can all you people on the road actually come in so I don't have to compete with the honking? That would be great. What I'm about to tell you is extremely, extremely important. My name is Natalie Quevedo, and I want to start off by saying that what I'm about to speak about is the best that I could do as a white-presenting person of color. I use my privilege on a daily basis to speak for other people of color who some may not be listening to. Why are you here? Are you here because you're pissed off that the laws changed in New Hampshire about abortion? Are you pissed off about what happened in Texas? Are you here because you're worried that we're going to turn into the Handmaid's Tale? Well, if you answered yes to that, I'm just going to politely ask you to check your privilege. Now, what I'm about to say may seem like an attack on some, and if it does, well, then I'm doing my job. This entire women's march around the United States right now is performative. What you are doing right now is performative. What I am doing right now is performative. People of color have been asking for you to listen since before the suffrage movement. They've been asking for you to listen when their children were being taken away from them at the border, and when women were being sterilized at the border. We have been asking you to listen since black women were enslaved and not allowed to vote, own land, learn, or basically do anything ahead of a white woman. And it's only till now that predominantly white New Hampshire and Texas enacted laws, and the media is paying attention, that some of you are now listening. Stop for a second and think about what I'm saying. Did you help fight for migrant women trying to come to the state? Did you help for the expansion of our welfare laws? Did you help fight against the cut in low-income aid to New Hampshire? Did you even help the women's shelters in Puerto Rico? Did you testify when critical race theory was banned in our schools? Yes, for some of you. Most of you probably not. Well then, what are you doing here? What are any of us even doing here? I am here to say that we need to stop being performative and take action. Use your privilege. Trust me, there's a time and a place to be performative, to be online and comment, to speak against the people who say you are virtue signaling or you're being too politically correct. You will have that chance, and some of you have already taken that chance. But the real world is here now, on the ground. Now is the time to think and take action. Women of color have been waiting for you to show up, and you are here now to do just that. If you take anything away from this rally, please take away the fact that we all need to do something. Do anything for somebody else. It is hard. I know it's hard. We will be ridiculed, we will sometimes be made fun of, but the reward that comes from that ridicule far outweighs the negative. Let's stop now being performative and take action. When you see injustice, use your privilege and record something that may be happening against a person of color, a trans person, a woman, a Hispanic person, or anyone that may not have the privilege that you have. Speak up when you see somebody being put down, mistreated, or being made fun of. Offer them guidance and a safe space to talk and be heard. Get involved. Use your name and status to help elevate members of your community who are underprivileged and need someone to speak for them. If you are scared, confused, tired, and concerned like I once was and want to learn how to make positive change in your community, come see me. Go talk to Rights and Democracy. Go see the Keene Dems. Go talk to the Cheshire Dems. And if you want to talk to me, I'll be standing next to that tree to show you and offer you some guidance on how I got past my privilege. Remember, you have the power to make change. These uncomfortable feelings that you have right now can give way to hope as we all work together to fight that privilege and make positive change for everyone. You can do this. We can all do this together. Remain uncomfortable and do something.
Thank you, Natalie. 100%. We have to be uncomfortable and we have to do something. And our feminism has to be intersectional. Our last but not least speaker is Dottie Morris, and I just have to say, really amazing that she's here today. State Representative Maria Elizabeth Perez was supposed to be here today, but she's fighting the good fight in D.C. and last minute had to cancel because she's going to bat for immigrant rights, and we believe here that dividing families is a reproductive justice issue, just as much as abortion is. It all matters. And so Larry reached out to Dottie, and Dottie last minute made it so she could be here today. We're just so grateful. Dottie is the Chief Officer of Diversity at Keene State College, and we're so grateful for you being here, Dottie.
I'm going to start by saying, I don't know why I put my notes on my phone, I can't see them. But I'd like to start off by saying all praise to our grandmothers, our great-grandmothers, our aunts, our sisters, and all of those women that we stand on their shoulders today. But I would especially like to thank my great-grandmothers, who had to breed a nation, who didn't have a choice, at all. So this particular issue is not an issue. It's a demonstration of power, dominance, control, and oppression. And we have to call it what it is. Because when you control someone's body, because we've been there before, it leads to all sorts of disparities, all sorts of pain and trauma for generations upon generations upon generations. I always tell people, I don't want to make a decision today. I don't want to make a decision today that my niece, nephew will have to apologize because of my actions. So I ask you today, where do we go from here? Every decision we make, let's ask ourselves this question. Will my child, my niece, my nephew, my neighbor ever have to apologize because of my actions that have an impact on people for generations to come? If the answer is maybe, don't do it. If it's no, don't do it. If it's a definitive yes, go ahead and do it. And know that you're taking responsibility and making a conscious decision to do what you're planning to do today. So I beg upon you to do that. And I'm so proud of the young people who are here. I'm looking out at my greatest inspiration under the tree over there. And the young person who came up and spoke earlier. I'm very proud of you, and thank you so much for taking up the charge. The other thing I want to say, especially to young women, this whole idea of shame is another part of this configuration. Be proud of being female and having female energy. Be proud to take that female energy everywhere you go. Because trust me, in this world, we need more feminine energy. Men can have that energy as well. So to my brothers, to my uncles, please take that feminine energy. Allow it to help you make connections with other people. And most of all, to have empathy with other people. So with that said, please, let's do those things that we know will enrich our communities and not deplete it. And please, don't make your children have to apologize for what you did. Thank you.